Kristen Andre, founder and chief strategist of Andre Consulting Group. I founded my company almost 10 years ago because I love helping people not only succeed, but thrive in their careers and their lives. So many times I meet amazing people who have so much more potential than what they're utilizing. As I engage with them, there seems to be a common theme: the limits they place on themselves. Throughout this podcast series, we're going to visit some incredible people who have created more intentional lives for themselves, those who've had that no limits moment where they chose to grow and they put things in motion to help them do so. We'll focus on how you can break through limits, we'll equip you with strategies to help you lead a more intentional life, and we'll have a lot of fun along the way. So let's dive in. Hi, everyone, and welcome to No Limits with Kristen Andre. We are here today with Will Hall, who is the CEO of HIPnation, which is an Atlanta-based healthcare company. And the cool thing is we are old friends because Will and I went to school together.
School many moons ago.
Many moons ago. Was 5-6 years ago.
Probably about 6, yeah.
It's fun. I'm excited to have you on the show because healthcare is a big topic of discussion these days.
It's huge. Yeah. Always in the media. Has been for 8 or 10 years.
Yeah.
20% of our economy almost.
Is it really?
18% of the GDP.
Wow.
Is healthcare.
Wow. Man, I think part of that's the premiums I was paying for a while.
I think you were part of it. Yeah,
I might
exactly.
I might be. Well, all right. So here's what's interesting is, people that listen to our show a lot know that I used to work in healthcare, have been out of the industry for a long time. But you and I went to physical therapy school together. So you, like me, are no longer practicing anymore. So tell us your story, kind of how you got to where you are and what you were doing career-wise and kind of what made you pivot.
Well, I think being PTs, I think we're caregivers at heart. And what you're doing right now is you're caring for people.
Yep.
You challenge them to not have limits on their thinking. We had to do that with patients, right?
Yeah,
they would
that's
come
true.
in, they have limits on, I can't do this again, my knee doesn't work. And so we were caring for people. And I think what we do now, the foundation of that was in physical therapy school. We took care of patients. I took care of patients for 10 years. I know you did for years.
Yep.
Kind of then went into the management side and the leadership side. And then I was caring for the PTs on my team, and trying to, help them love what they were doing, being able to love patients. And so I did that for about 10 years and then jumped into this about 3 years ago. And I think having the caregiving piece when you're in healthcare, because, that's an uncertain place for people to be.
Right.
Your body's not working, on the financial side, there's a ton of issues on the financial side. And so I think what we're building, my PT background gives me a good understanding of that, and just, caring about people, wanting to put something together that is better than what they experience.
So let's talk about that for a minute, because before we dive into really HIPnation, which is, it's new. I mean, it definitely, I think, is going to revolutionize things. But let's talk about the industry as a whole, because it's kind of, the healthcare industry is messed up at this point.
Broken.
It's
Totally
really broken. So how do we get there?
Well, I think the biggest issue is, there's so many issues. But fundamentally, the problem for us, we think, is one of the key pieces. How do you just say the problem?
Yeah.
One of the biggest problems is insurance is not in the right place in the system.
Yeah.
And so insurance is in every piece of the system now, and healthcare and insurance are different. Healthcare is when you sit in front of your doctor and you have a health issue. Insurance is how things get paid for. And so you have about a less than a 10% chance of accessing a hospital in a year. That's what you need insurance for.
Right.
And so the most fundamental piece that everyone gets is think about your car insurance. You have car insurance for a low cost, a low probability, high cost event, a car accident.
Right.
And when you have a car accident, you file your car insurance, but you don't file car insurance for new tires, oil changes, and all that kind of stuff.
Right. That's your maintenance.
If you did, you wouldn't be able to afford car insurance. And so we just think one of the most fundamental things is insurance is in the wrong place. Put it in its right place, then you get better access to health care, which is how people get healthy, and your catastrophic or insurance costs will come down, because if I'm not worried about insurance with poison ivy and sprained ankles and shoulder issues that we were working with, that's not a place for insurance to be.
Right.
Then access to healthcare gets better, insurance costs go down, people win, better access. You get practitioners are way more happy. Doctors love it.
They would have to be, because even, down to the physical therapy side, it was frustrating to want to be able to help somebody and spend time with a patient. And you're like, all right, you got 5 minutes, your next person's waiting, and you couldn't really spend the time or the care or anything we were trained to do.
Absolutely.
And I would assume the physician space, not being a physician, but most doctors get into medicine because they truly want to help people and they have an interest in how the body works and how to heal it, but they're not given the opportunity to do that.
It's a crazy system.
I mean, our doctors the pediatricians spend a little bit more time because it takes a while to get the information out of the kids.
Right.
But for adults, I mean, I don't know what the average probably is. I'm guessing most doctors are with their patient 5 minutes or 8 minutes.
8 minutes, a little bit less than 8 minutes is the average in our country.
How about that?
Time with the doctor.
So you think of all the stuff going on. How do you get that out there?
Yeah. How do you take care of something as complex as health in our body and all the things that go into it? It's not just the physical piece, it's stress and what we were talking about, earlier. It's stress.
Oh, stress is what's doing it. I am blaming stress, and these children, if you're listening, children, this is my healthcare issues.
There you go.
It's the stress of it.
All this gray hair came from my kids. That's what I tell my kiddos.
Right.
So,
exactly.
You knew me when I didn't have that. No kids.
I know.
And PT school was all dark.
Exactly.
But it is, so how do you really take care of, something as complex as our body and our being in less than 8 minutes? And so that's part of the brokenness. And so, and you think about on PT side, right? When we were trying to take care of patients, we worked for big organizations that had huge revenue cycle functions dealing with the insurance side.
Yeah.
And millions of dollars, change the way you have to treat patients and all those kinds of things.
Yeah, it always astounds me, like if you see what is charged versus what the provider actually receives. And that, outside looking in now, since I'm not in the industry anymore, I'm sitting there going, mathematically, this doesn't make sense. I left healthcare, went into finance, and now I'm in the numbers part of it going, it's not sustainable.
Sure.
It's just not sustainable for either side.
Right.
It's too expensive for the insurance companies, and the providers aren't getting enough money from the insurance companies. So why do they want to
So it becomes volume.
Provide care. It becomes volume, which is why it's 8 minutes per patient.
It becomes 8 minutes a person. And so then you get a burned out physician that you only get 8 minutes with. Physician burnout's a little over 60% in our country. 60? 60.
Holy cow.
So you're getting a very little bit of time with a physician who has a likelihood of burnout. And like you said, they go to school. Many are second, third generation physicians. All they ever want to do is take care of people. And now you're in a system that doesn't allow it. And so it's pretty broken, for sure.
It's scary, and then on the consumer side of it, not just with the patient care, but for me, I've run my own practice. I'm self-employed. My employees are all contract, so I don't need a bunch of benefits. I just need take care of me. And it's impossible nowadays to find, until somebody like what you guys are doing. There aren't companies out there. The big companies, at least in Georgia where I live, they're not providing individual health coverage anymore. So you've got all these people that need it. And I have a girlfriend of mine who's diabetic, type 1, obviously diagnosed at a young age, but her medications alone are just, it's a salary to pay what it costs. And then, she didn't have a lot of options at this point, and you're seeing things where people can't afford it or anything like that. So people are just doing without it. Yeah,
that's the scary thing. I've talked to members of ours who are rationing medication.
I've read articles on that.
Yeah, so twice a day, they take it twice on Monday, once on Tuesday, twice on Wednesday. just crazy things around that. We have a great testimonial. One of our founders actually is type 1 diabetic, and he talked about he saved $30,000 in 2 years on his healthcare cost.
Holy cow!
Dad, husband, 3 kids and 4 kids. He would laugh about that. But saving $30,000 in better healthcare. He even told me, he said, my A1C now is better than it's ever been.
Because you're paying attention to it.
Yeah, you're paying attention to it, and you have a physician now that's not, divided loyalty, has time to be able to talk with you about all the nuances of managing that as a type 1 diabetic.
Because for me, it's at this point, because, the insurance was, I would say for several years, I was paying for it. It was a lot of premium, and it kept going up and up and up and up, astronomically up and up.
Right.
Well, I I'm fortunate enough where I own my own company. I can work harder. I can make more money. I can scale and grow the company. But a lot of people who are on a salary, you can't just all of a sudden go, okay, I need to make $1,000 more a month next year to pay for this. That's not an option for a lot of people. And so I could see rationing medications or what have you. For me, what happens, I just I'm not even going to go to the doctor.
Right.
It's going to cost me. It's going to cost me more to go. It's kind of that we joke with the kids, are you bleeding? Have you lost consciousness? This is about when we'll consider a doctor visit now. And that's scary.
Yeah, we produce a less healthy culture compared to where we were 15, 20 years ago. We're less healthy. Obesity rates are up, diabetes rates are up, all of those things because of access, so we avoid the doctor because of copays being a barrier.
Yeah.
And so really the fundamental piece, foundational of what we do is 24/7 access to a primary care physician. That's how people get healthy.
Does that help? All right. So getting healthy, because I agree with the obesity's up and all kind of things like that. Is it because we don't have access, or is it because people are just getting lazy and slacking off and skipping the gym?
Well, I'm sure there's multifactorial pieces to that. But for one, when you take away those barriers to access and you restore the relationship with your physician, you've got a physician who can sit down and not spend 8 minutes with you and talk about your goals and, not just your blood pressure, but talk about those kids stressing you out and your job and all those kind of things.
So they have the time to
so they have time. Now you have a relationship with a doc who can sit down, and it's not a 15-minute physical once a year. It's, okay, Kristen, what are your goals? Let's put some things in place, and let me give you a call in a month. Let's talk about this. Let's meet for coffee and talk about it. One of our docs talks about she loves to meet for coffee with her patients and talk about where they are, with the patient or their spouse, and kind of put plans in place. Because now you disconnect the doc from that paying system.
Payer system.
Yeah. And so now it becomes about taking care of people again. And the statistics about being connected 24/7 to a primary care doc who knows you are phenomenal about people getting healthier. You're 80% less likely to have surgery. If you're in the hospital, you'll be there less days, you spend less money, people, blood pressure, cholesterol goes down, all sorts of things. Because we're relational beings, right?
Yeah.
And now you get a doc who is relating to you and is in the boat to try to help you get healthy.
How about that? Because, I think so many people just ignore their health because they don't want to talk about it.
Right.
I mean, I'm guilty of that. I mean, fortunately, knock on wood, I've been healthy other than hobbling around when my knees stop working. But you kind of avoid it until something happens that forces you to take a look at it. And that's got to be more costly if we're kind of waiting until something blows up.
Yeah, the downstream costs are huge for that. I was talking to someone the other day. We were talking about what we do and, the membership. And I said, your first physical will be dramatically different than any appointment you've ever had. You're going to sit down, you're going to talk with the doc about all your goals, all those kind of things, blood test. And he said, I haven't seen a doctor in years. I really don't want to know. I'm like, you're like,
that'd be me. Just don't tell me.
You're 50 with a family, man. Now's the time. Take care of that stuff. You want to be around and healthy. Exactly.
Yeah. Okay.
Yeah. That's kind of our human nature. I don't really want to know about it. And then it won't bother me.
Well, because the thought is, if we don't talk about it, if we don't bring it up, then it's not real.
Right.
The health issues or whatever else it is. It's not, if I don't admit that I need to lower my cholesterol, do this, do that, then I should be fine.
Right. Exactly.
Awesome. Very cool. All right, we're going to take a short break, and when we come back, we're going to talk more about what Will and his team at HIPnation are doing and how it's really revolutionizing healthcare for a lot of people. So we'll be back in just a few. Hey everyone, it's Kristen. Be sure and visit my website at www.andregroup.com. That's www.andreegroup.com. And while you're there, be sure to download my white paper, Top 10 Reasons Your Business Isn't Growing Fast Enough. Now get out there and create your no limits moment. Welcome back to No Limits with Kristen Andre. We are here with Will Hall, who is the CEO of HIPnation, based here in Atlanta. And before the break, we were talking about kind of the healthcare system and how it's kind of broken right now. And you guys have really because I've had a chance to talk with you offline about what the company's doing and where they're going. This is a really cool concept, like a really cool concept, especially not just for people like me who can't find insurance elsewhere, but just for everybody. So talk to us about, well, first of all, HIPnation. What's the name? Is it my hip? What's up with the name? Tell me what's up with the name.
Well, for one thing, we're a bunch of old guys trying to be cool.
So your hips are hurting. Okay.
And the teenagers didn't go for that. But really, we were founded by 3 physicians and a healthcare attorney. And the P was partner, healthcare impact partners, to really partner with folks.
Help them get partners. Okay.
Partner with folks, help them get healthier, save money, more affordable healthcare on the individual side, and really small businesses. Because, when we talk about, solo folks, but a small business, the number one thing on those business owners is healthcare costs.
Yeah.
Goes up 10-15% a year. I just talked to a business owner, had a 40% increase.
Yeah.
2018.
Not uncommon. Yeah. So what made the physicians and the attorney start this? I mean, kind of what was their what did
they're all small business owners for one.
Okay.
And so they saw the escalating costs, and the docs just saw that, as one of our chief medical officers says, you get out of medical school, you want to take care of patients. And he said pretty quickly, the first course he had to go to was a billing and coding course.
As a physician?
As a physician.
Wow.
Med school, undergrad, med school, residency, all those kind of things. You're a surgeon, their first course is on billing and coding. And he said it was kind of the wake-up moment saying, this is not what I was thinking is going to be. And so, they just started looking at the system and they're physicians, and they talk about, the way they treat disease is you diagnose it. What are the symptoms? What are the causes? How do we go against those things? And started looking, and really took, it's about 8 or 10 years in the making, writing a couple of books, talking to economists on both sides of the aisle, testifying on Capitol Hill, all of those things to kind of come to the point of finally saying, we think we know how to fix it, put insurance in its right place, and give people better access to primary care, and build a system that's more affordable. So let's go build it. So about 3 years ago, they started Healthcare Impact Partners, talking with small businesses. And then after a little bit of time doing that, just said, let's go build this thing. And that's where I came in to
very cool
connect with these guys.
Very cool. But it's all right. So the concept of it is, and you'll have to correct, because I'm going to give you the layman's terms for it. So it really, the way I look at it, it's taking the insurance piece out of it, pretty much.
It's putting catastrophic care in the right place.
Right. So it's insured. I'll have some insurance in case, I call it the car wreck, blowing out my knee, cancer type of coverage.
Yep.
But then all the stuff I'm avoiding, going to the primary care,
getting your physical.
Exactly.
Yep.
I mean, I'll get a physical once a year.
Yep.
But right now I pay for it out of pocket. Mm-hmm. I just pay cash, and my physician is fantastic, but I have no contact other than that. So if I have a headache, a sinus infection, stress, like you mentioned, anything like that, I'm just ignoring it.
Right.
Because I don't have a primary care. So the primary care in physicians with HIPnation, it's almost like they're your person.
They're your person. It's your own personal concierge physician for you.
And you told me before, you can call them, text them. I mean, you actually have a relationship. It's not like, I think one of the things that I avoid is I have a very busy schedule. I don't have time a lot of times to call the doctor, make an appointment, go in at the available time slots they have, sit there and wait for it's not efficient with my calendar.
Right.
But you guys don't operate like that.
Yeah, why do you have to go in if your doctor doesn't think you need to be in?
Right.
And when you have a relationship with your physician.
Well, and I think the reason is because you have to go in so they can bill you.
Yeah. I mean, they don't run a nonprofit, right?
Right.
And so to give you a great example. So my teenager comes home sick over the break. I get sick. I'm talking with my doc, calls in. I talked to my doc, and she said, who knows Kelly, she's my wife's doctor too. And she says, hey, by the way, this is really contagious. When Kelly starts coughing, she needs to call me. Next morning, Kelly starts coughing. What does she do? She doesn't have to, go make an appointment or anything. Calls the doc. Yep, you were right. Calls in the Z-Pack. And so we deal with this thing much longer. Kelly is on a Z-Pack within 12, 18 hours.
She didn't have to wait, get in, go see him.
Exactly. The doc knows this thing's going all over every place. She's on a Z-Pack and is in 36 hours is good to go. And
now is the reason y'all can do that is because the doctors know you and know your family and took time. So like, what is your first meeting like with a new primary care?
Well, the key piece is if you take insurance out of primary care, now the docs take care of about 70% less people. So instead of an 8-minute appointment, you have a physician who truly has the time to spend with you, isn't worried about okay, I need to do this test with Kristen, but maybe your insurance company won't let me. Maybe I've got to get a pre-authorization. All that stuff goes away. And if we want to do the test, you'll pay cash for the test at a much reduced rate.
Yep.
And so
the rates are way less than you're paying with insurance anyway.
Because you're taking insurance out of it, right? It adds cost to things.
Yeah.
We call it the magic wand. Everything insurance touches, the costs just go up.
Okay.
And so the docs love it because we said you've got physicians that are 60% burnout.
Okay.
Now they actually get to take care of you, not worried about what, an insurance company is saying what needs to be done or not for you. They take care of you. And then they have specialist physicians that support them. So if you've got a knee issue, they've got an orthopedic surgeon that they can give a phone call. You need an MRI, you go get an MRI at a cash rate versus an elevated insurance rate. So you're paying a true cost for that MRI, $400 instead of $2,000 to $4,000.
Yeah.
And so all of those places in that 90% of healthcare where you don't need insurance. But then, like you said, if I have cancer, now I need insurance. And that's what I have for those times. But everything else I'm going to pay out of my pocket.
Right.
The majority of my healthcare is going to be at my primary care, who really knows me, can spend time with me. I've got her cell phone. I call her, text her, whatever's going on. She texted me the other day, hey, how are you feeling? I said, well, I finished the Z-Pack, still coughing. She said it takes 5 to 7 days for that to go away. Well, great.
So she followed up with you.
Yeah.
Oh, wow. Okay.
Just text. I don't, I'm not calling her about it. I'm just like, I'm the typical patient. Well, I've done the Z-Pack.
Yep.
Well, why am I not better? She said 5 to 7 days. Okay. Well, now that I know that that's the case, in 5 days, if I still have an issue, I'll shoot her a text or I'll give her a phone call.
Call her.
Yeah.
Now, one of the things I thought you mentioned to me before is that your physicians, they have a set number of people they take care of.
Yeah. So the average primary care can be anywhere from about 2,000 to 4,000 people in a panel. That's why I appointed.
So wait, a normal primary care that I would go to, they have 2,000 to 4,000 patients.
Right. So when you walk in, you get
lot of patients.
Get that big bank of charts.
Yeah, exactly.
Anybody can call at any time. That's why, I think someone was just telling me it's over a week wait in Atlanta for almost a week wait for a sick visit.
Oh, wow.
It can be up to a month for a wellness or a physical, right? Because you've got 2,000 to 4,000 people. Our docs take care of 700 people. You get their cell phone. So you sign up with HIPnation. You sign up with pick your physician. You sign up. You get an ID card with your doctor's cell phone. And so we say, Kristen, put your doc's cell phone in there. First thing we want you to do is get a physical. Yep. It's going to be dramatically different than any visit you've ever had. Let's put a plan in place. And then now you've got your own doc. It's kind of like having a doc in your family, right? If you have a sister who's a physician, you wake up on Saturday morning, you got something
That's
going.
That's who you call.
You'd call your sister. Now you call your doc who knows you, knows your kids. Both my teenagers, have their own 24/7 doc. Caleb's out of state at Auburn, so he's sick on a Saturday. He doesn't go to student health. He calls Dr. Herrera, who knows him, knows what's going on.
He's able to do something.
Absolutely.
So hearing it, I'm just like, it makes sense. It makes, I'm a fan. So it's ideal for people like me who don't have other options anywhere. But it makes sense for everybody because it gets them back to, you're out of the business of medicine and you're actually into the medicine.
Exactly. You're into the healthcare about you, and it's funny. I talked to one of our members the other day and he said this, a lot of health issues. And he says, the system has failed me for years. It's always been about a symptom. And he said, I'm healthier now because my doctors, it's about my healthcare and what needs to be done for me to be healthier. Yeah. He said, that's where this is.
Which is a big thing.
And I love talking to members and kind of hearing them, their experience and the way they explain it, the way they've experienced, and our physicians, to be able to say, one of our docs said, I've had more joy in medicine in the last 8 months after being with us 8 months. I've had more joy in medicine in the last 8 months than in 15 years.
And that's the kind of doctor you want to work with anyway, that's somebody that's loving what they're doing and genuinely wants to help.
Absolutely.
So where is HIPnation going? Because I know you're in Atlanta.
Yep.
Which is yay for me. So those of you guys listening who's not in Atlanta, sorry. But no, you guys, this is bigger plans. It's HIPnation, not HIP Atlanta.
Exactly.
So where are you going?
Well, so we want to be in the South to start. So we have conversations right now in Florida and Texas and Alabama for this year. We also are taking care of a business in Atlanta already that has employees in North Carolina and Colorado. So we're taking care of folks there with a 24/7 doc. But we do, it's a national issue. And so
it's definitely a national
and physicians
issue.
Are burned out. We have docs calling us from all over the country because they love the model, because it's founded by physicians. who
Yeah.
diagnosed the problem and said, look, let's get back to really taking great care of people.
Yep.
And that fixes everything. So we'll be in a few more states, I think, by the end of this year.
Okay.
And, we'll just keep taking great care of folks.
I think all right, so all you guys outside of Atlanta, you got to call and say, I'm here in Wyoming. We need your help.
Absolutely.
It's definitely needed. I mean, I think the coolest thing that I'm hearing, not only is the opportunity to get in front of physicians again, but I love the fact that the physicians are finding joy again, because no one wants to really be doing, that's a lot of school. I mean, PT school was hard. I can't even imagine what medical school was. And to get in a career that you went into to help people and get out can't help people because of all this.
And think about when we were taking care of patients, right? We were constantly trying to get better, reading journals, taking courses, all those kind of things. Another one of our docs said, I've been able to read journals on the new updates on medicine more in the last 6 months than I have in years.
So up on everything.
She's now becoming a better physician because she's going to take care of patients, and it's about patient care again. It's not about billing or coding or, I've got to drive more volume through my door. It really just becomes about taking great care of people. And we do that on the individual side. And we were talking about, taking care of a family. I mean, the economics for a family of 4 in Atlanta is, on the exchange, is about $2,000 a month. For us, it's about $800 to $1,000 a month.
Okay.
So you're about $12,000 back in a family of 4's pocket.
Yeah.
Pretty.
Especially when you got kids in college.
Exactly.
And things like that.
We just signed up a small business. Excited to work with these guys, 38 employees in Atlanta, and saving $60,000 for that small business owner.
Wow.
In 2019.
How about that?
$60,000, $5,000, and you have better health care for every single one of your folks. So, instead of employees having to get off of work to go to a doctor's appointment, just let me call my doc. Let me do a Skype appointment with my doc. All the things that they truly can do. And then if I really need to go in, my doctor decides I need to go in. But the vast majority of those things, whichever relationship, are not on the phone.
They're not on. How about that? That's so cool. All right, we're going to pause again. And then when we come back, we're going to figure out how to take all this information and help you and your health care and how you can take better charge. So we'll be back in just a minute. Everyone, check out my podcast, No Limits with Kristen Andre, on Tuesday nights at 7:30. We will tackle the things holding you back and the limits you set on yourself and equip you with some strategies to lead more intentional lives. Podcast launches every Tuesday at 7:30 p.m. on Facebook.com/Andre Group. That's Facebook.com/ANDREE Group. We'll see you there. Welcome back, everyone, to No Limits with Kristen Andre. We are wrapping up our time with Will Hall from HIPnation. And prior to the break, you were sharing with us all the cool stuff you guys are doing, which I'm really impressed. I think this is something, it's going to be big. It's going to go everywhere.
We think.
Because I'm not scared of going to the doctor. I'm just like, I don't have time to make these phone calls, to drive all the way over. So I'm really intrigued by the relationship piece that it offers. Because I feel like if I could shoot a text or make a phone call to somebody that knew me well and say, here's what's going on, and get a response, you're right. I don't need to go into the office to do that. So for somebody like me, and I'm sure people have their reasons. Some people don't like doctors. Some people don't trust them. For me, it's just, I'm just busy. I don't feel like taking the time out. So it's the start of a new year. We're all concerned with our health.
Yep.
So what do you think with health when you hear health resolutions from?
Well, was driving here and the gyms now have their New Year's start sale.
Oh yeah.
Everybody knows that the gyms are full right now. Health resolutions are one of the top New Year's resolutions. They don't get kept.
Yep.
I mean, people
do
the same resolution year after year. What I've seen with folks being connected to a 24/7 primary care physician, that relationship changes everything. And so when you have a doc who's along for the ride, and you've got to prioritize your health. Our doctors talk about you get one shot with your body. We can't just go outsource it. And I was mentioning, I was doing a speaking the other day, and a guy was saying, I haven't seen a doc in 10 years. And I said, man, if you drove a Ferrari and you told me this thing is awesome, I haven't serviced it in 10 years, I would think you were an idiot.
Everybody
right?
would think you're an idiot. No one would even conceive of not
Exactly.
taking their car in for service.
Exactly. And he said, yeah, that's right. And I said, man, your body, your health is worth way more than a Ferrari. You got to take care of yourself. And he's like, I never thought about it that way. I'm like, that's how we have to think about it, because, for the things I want to do, we had kids in college, as a granddad, that starts now, me taking care of myself. And so I would say folks have to think about it, don't make it a New Year's resolution, make it, hey, by the end of January, I'm going to think about doing something different about my health. Get an accountability partner, talk with someone, on what you're going to do. But we get one shot at our health, and everything comes from that. Your energy, your employment, your
everything.
Relationships.
Yeah. And most of us wait until there's a challenge or an issue to start addressing it.
Yeah. Then we become reactive.
It's totally reactive. My health care for myself, I'm totally guilty of this. It's like, knees hurting. It's fine.
Right.
It'll be good. And then all of a sudden when I can't, bend or straighten it, and then probably should see somebody.
Yeah,
now.
Let me go do something. And think about it, from the PT side, all the stuff we could do from prevention and prehab and all those kind of things. So, and it's the little things that make a huge difference. So let's get out of reactive healthcare. That's part of the problem in our country, is we're very reactive. Now I have an issue, let me go take care of it, versus being proactive, taking care of myself with a relationship with a doc. That is a game changer. I just can't emphasize that enough.
Yeah, so
that changes everything.
It is a big thing, because then you're really addressing it up front with somebody who knows you and who cares. And if it's reactive, that's the, let's do a surgery, let's pop a pill, let's do something like that, which is way more costly than doing a little work on the front. I love the Ferrari analogy though, because we all do that. We all, I got a call from my dealership, or just one of their regular calls, like, oh, you're due for maintenance.
Right.
And I'm like, oh, okay, I need to make an appointment. We just don't think twice about when our cars need to go in for routine maintenance.
Exactly.
But I wouldn't have made that analogy, but you're right. The cars cost way less than the healthcare issues.
Absolutely.
Okay.
And you can go get another car.
That's true.
Anytime you want.
That's true. All right. So we issue a challenge to our listeners at every episode. And we have a page on Facebook. It's at #NoLimitsMoment, where our usual listener, if I can talk today. So the people that listen a lot, they're always going in and engaging. So we want to issue a challenge to them so they can stay on track with this. So what do we want them to do?
I would say think differently about your health.
Okay.
Think about the things that you've done to maintain your car, your house, those kind of things. It's we're in Atlanta, so people are going to go blow leaves out of their gutters and all those kind of crazy things, right? We do all those things. Think about taking care of yourself, your health, and getting an accountability partner, getting a physician. Obviously we think, a 24/7 doc is a key piece of that, but don't put it off. Don't put it as a New Year's resolution. Don't get to the end of 2019 and think, gosh, I wish I had done more to take care of myself.
I love it. Love it. So we need to I think this is the challenge. Let's find whatever your healthcare goal is. What one step do you need to take control of your health, even if it's getting on a maintenance plan or doing something. And I love the piece about finding an accountability partner.
Yeah.
I think that's a good one for the year. So awesome. All right. So that is our challenge to everybody listening. Find an accountability partner, come up with whatever it is that's holding you back healthcare wise, and do something towards that. Make a decision. Join us at our page on Facebook, #NoLimitsMoment, and let us know what you're planning to do so we can help hold you accountable and we can help encourage you along the way. Because like Will said, you only get one body, one chance to take care of it. So let's make sure we're doing it the right way. So Will, thank you very, very much.
You.
I can't wait to watch HIPnation grow and
absolutely. Thanks for helping
all
us.
the way across. No, I think it's great. It's definitely a worthwhile cause. So awesome. Good seeing you. Thank you so much for being on the show. Until next week, everybody, keep pushing past those limits.